Hi, besties. Good to see you today. We're going to talk a little bit about arrhythmias and what I learned yesterday in the PhD in original medicine program that I'm in. This information I'm giving you is not meant to treat, diagnose, or cure. It's just meant to inform you so that you can get some information and perhaps start off on your own research to find ways to naturally cure yourself without pharmaceuticals and surgery, when at all possible. We're going to talk about the causes, treatment, and preventions of arrhythmias. Some of the causes that I found were congenital heart defect, and that's something that develops before you're born, current heart attacks, scarring from previous heart attacks, um, cardiomyopathy, mitral valve prolapse, coronary artery disease, high blood pressure, obstructive sleep apnea, diabetes, over or underactive thyroid gland, caffeine, tobacco, alcohol, chocolate, cold and cough medications, appetite suppressants, asthma drugs, diuretics, psychotropic drugs, beta, that's your the psych meds, beta blockers, recreational drugs, drugs for arrhythmias. And here we go. The drugs that are given for arrhythmias cause arrhythmias. So if you can get away from pharmaceuticals, it's great. And just use natural methods. Nutritional deficiencies, hormone imbalance, food sensitivities, air pollution, stress and smoking, electrical shock, dietary supplements. There's one main treatment for arrhythmias. And just a little bit about arrhythmias. That's the improper heartbeat, an imbalance in your heartbeat. If your heart is beating too fast, it's bradycardia, and that's 100 beats or more per minute, or too slow, bradycardia, that's 60 or less beats per minute. And um, that's just a little bit about arrhythmias. Treatment, the Mediterranean diet. So that's a popular diet, and it's a really good treatment for arrhythmias. In fact, it as natural treatments, it's one of the main treatments to switch your diet to the Mediterranean diet. And there's a whole plethora worth of information on Mediterranean diets on the internet and even on YouTube, and you can Google it. Use good food sources of magnesium. Omega 3 from cold water fish is really good, to add to the Mediterranean diet. This is an addition, um, and I believe called for to use within the Mediterranean diet, cold water fish. Good food sources of potassium. There's acupuncture, and you can seek out an acupuncturist. But if you don't want to go with pharmaceuticals, you can seek out an acupuncturist. Acupuncture, because it deals with the electrical, it affects the electrical impulses in the body, and that's what causes your heart to send the neurons to tell your heart to beat. If I'm saying that right, I'm a student, so this is what I've learned so far. And if I'm wrong, look in the comments, and leave a comment telling me where I'm a little off center, so that we all can learn and be better for it. Spinal manipulation is a good, non-invasive way to treat, natural way to treat arrhythmias. Biomedical hormones for women who are going through menopause, and intravenous magnesium. Good prescriptions are magnesium, coenzyme Q10, fish oil, which you should be able to get relatively easily, hawthorn, L-carnitine, motherwort, potassium. Preventions. Eliminate the substances listed in the causes. I gave a long list of causes like alcohol, chocolate, um, caffeine, tobacco. If you can avoid beta blockers, psychopatric drugs, if you could use natural herbs to and find other ways to manage your mental illness symptoms if at all possible. I'm not saying stay away from drugs. I'm not saying stay away from pharmaceuticals. In some cases, on extreme cases, I find that it's necessary. But if you can, if you have mild to moderate symptoms of anxiety, depression, um, insomnia, um, herbs like as we had spoken earlier yesterday, I believe, was it yesterday or the day before yesterday on anxiety? Herbs like botanicals like passion flower, chamomile, lemon balm, St. John's wort, which is pretty strong, kava. Um, Eat a heart healthy diet. Reduce, if you can, for some people, they're sensitive to electromagnetic fields and it actually causes arrhythmias, imbalance, heartbeat, um, an imbalance in their heartbeat. So electromagnetic fields like computers and routers, some people have to stay away from this. So if you find when you go to your doctor, make sure that you ask him to do a little delving and figure out what's causing the arrhythmias so that you can keep it from happening again in the future. Whether it's the chocolate, whether it's the diet, or something um, that some surgery or something that you've had in the past, or electromagnetic fields. Okay, that's just a little bit about arrhythmias. Um, Glad to see you today. If you have any questions, leave them in the comments. If you have anything to add, because once again, I am not your doctor. I'm not yet a doctor. I'm a PhD student. So this is just my research. And I'm just coming on every day to share a little bit about what I've learned and what I've done yesterday um, with you so that if you're studying as well, you can resonate with me. You have a study buddy. I'm your study buddy. I'm your help if you're doing self research, um, if you're doing self study. Don't be afraid to come on to leave a comment, leave your email if you want, um, and we can be accountability partners if you want, or I can. And if I don't have the answer, I can share with you what I know and what I've learned. And if I don't have the answers, I can find out. I can talk to my professors, um, the doctors that I work with in this course of study. Okay, if I've helped you in any way today, please like, share, and subscribe. Um, and as always, I look forward to seeing you in the next video, and God bless.